a pretty good buffet for after lunch, I think. So with that, if I could ask the other panel members to please come up and have a seat, and we'll open it up to questions. And again, if there are questions from roundtable members, I'd invite those first, and then from others as well. Excellent.
Hi, Lynn Goldman, George Washington University. So I have a question really for all of you. I mean, it's just a tremendous number of new developments that are happening, and an awful lot that's been going on in terms of trying to advance the science, whether it's, you know, for testing, for risk assessment, for exposure assessment. Is there any hope that any of it is going to make it go faster and more efficiently, given the numbers of chemicals that the chemicals program at EPA has to confront?
I think that there's tremendous opportunity, and I think particularly when you hear Richard's talk in the next section, where they're dealing with the greatest number of chemicals the most rapidly, what will be a concern is if we get bogged down in terms of arguing about angels dancing on the head of a pin again. One of the things I think that's happening, though, is in the field of medicine and pharma, that personalized medicine, that a lot of how to do risk assessment is moving forward apace. And my concern is actually that the toxicology community will kind of be left behind. So I think there's going to be progress that's going to be made, whether the conventional community does anything or not. But I'm hopeful that we'll move forward.
I think the real challenge is in bringing along the different customers, bringing along everybody within the agency, the regulated, the community, folks who want to be engaged. It's such a rapidly moving field. The combination of, you know, understanding toxicology on the molecular systems level, if you put a lens over that of a sort of more predictive exposure analysis and feeding back and forth between structure and likely exposure scenarios and the like. And we're talking in a language that's, it's always been difficult to engage the community on. Now you have to engage it, you know, in informatics, computing, and at the molecular level. So that's a real challenge, I think.
I agree with that, and I think what we're saying is that the scientific advancements and technology sides tend to draw us in the opposite direction, towards more involved and more complex, and that it's the political and social side that would be moving us towards a more streamlined process for a lot of decisions. And I'm going to speak with complete naivete because I have not been in this world very much since this report came out, but the report was making recommendations for guidance to be developed about this right sizing. And I know that we're investing in and making progress on the technical side, but I'm just wondering, you know, is there a place where these kinds of guidance and tiering systems that were proposed by the Science and Decisions Committee to try to streamline and improve decision making, are those processes also going on? I don't know.
Bernie Goldstein, in a sense, I'm following up on what John just said. First, superb. I mean, this is such an exciting time, and there are so many really exciting things happening in moving forward. John, let me be frank. When I read Science and Decisions, it seemed like it was written by two committees. One committee focused on right sizing and on how complex.
That's an underestimate.
Okay. But there was this focus on, you know, we can't make things more complex. We in the academy often make it more difficult for EPA to be able to do something because we're imposing, we're saying you have to do certain things which EPA doesn't know how to do. We don't know how to do either. We're just saying do it. And on the other, you know, and on the other hand, there were all these, you know, let's do tiered Uncertainty analysis. Well, there isn't a regulator I know who really likes to get an uncertain number, let alone knowing how to do it. Let's put together cancer risk and non-cancer risk into one nice homogeneous thing. I didn't hear, for instance, on those two, anything that would suggest that we are working on putting together some of these more adventurous kind of things that came out of your panel. And your panel is what, 2009, I think, is the report. So it's already a couple of years old. Is there anything moving forward in the toxin in your really interesting work on trying to put together cancer and non-cancer, or is that something that's sort of different?
I think one of the things that's going to evolve out of looking more at the molecular basis of disease, it doesn't parse very well into cancer and non-cancer. So I think it's going to force some sort of common pathway. So I carefully avoided the other part of your question.
Yes.
Jerry Paul, oh, go ahead.
Bernie, I was just going to say that while I was at EPA, one of the stated objectives among programs and the research arm was to harmonize cancer and non-cancer. And I left in 2005. So.
Jerry Paulson, George Washington University. I wonder if we have kind of blocked ourselves into a narrow way of thinking by our choice of words for describing what we're trying to do. We talk about alternative chemicals assessment. And do we really need always alternative chemicals? Because sometimes maybe we don't need chemicals at all. I look at the debate about flame retardant chemicals in furniture. And do we really need to have DFE spend a lot of time looking for alternative chemicals to be flame retardants in furniture when it's not clear that we need flame retardants in furniture? Or there was a recent request, again, from DFE. I don't mean to pick on them, but they're the public arm of this activity, for comments on safer fragrances for commercial products, for consumer products. And again, the question in my mind is, do we need fragrances at all for consumer products? And why do we spend the time looking for safer chemicals when the safest might be none at all? So how do we get that part of the dialogue in that I at least perceive as missing? Maybe I'm wrong.
Jerry, I don't know how to get that into the dialogue, but I just want to say that the discussions that we had in the committee were exactly of that nature. And what you're describing is, you could call it, somewhat stereotypically out-of-the-box thinking. And when there was this discussion about the formative process and about the decision framework, there was a lot of discussion in the committee about how outside of the box do we go when we put down our array of choices. And those questions that you're asking, even though the example I gave was one of alternative chemicals, those questions that you're asking of what is really all of the options. Do we need this, do we need to be exposing people to this to obtain the what's the societal end we're trying to get, and what are the different ways to get there, and does it need to be something that involves chemical exposure? Was very much part of the discussion. Now, I don't have the answer to your second part of the question, which is how do we really operationalize that in the decision-making framework? Again, I think that's a political and social process.
Merely, because I was going to comment on something you might want to comment on. Go ahead.
Well, I was just going to say, I think that will also come up as part of this new committee's study. The title is Evaluation of Safer Chemical Substitutions, but I believe my understanding or thinking is that it's likely that they're going to be having a broader discussion too about sort of not whether or not we need fragrances in something per se, but more looking at, for example, looking at changes in process too is another part of that, and whether it's not always a strict chemical substitution issue.
Any other comment? Okay, Gina?
Gina Solomon, Cali, PA. And actually, in response to Jerry's question, in the California Safer Consumer Products regulations, we have devised an off-ramp, we call it, where if the state identifies a chemical of concern in a product and lists it, the manufacturer of that product may either perform an alternatives analysis, or they may simply take the chemical out of the product, and then that would save them the trouble of having to go through the entire alternatives analysis. So there is, there are ways to we'll see what comes of that and whether that actually does incentivize removal of some of these chemicals altogether. It'll be interesting to see if that does happen. But my question actually is to Paul and on the exposure side. And I sort of want to have a little more discussion on some of the different, I guess this is apropos of all the right sizing and the, tailoring, and to push back a little bit on the, on the bottom line of the Exposure 21 report being, test everything all the time, because I think we did look at least 3 different categories that I remember. One is the new chemical coming on the market, where the challenge is, without even knowing everything that it might be used for, to somehow project something about use and therefore exposure, and what the strategies would be in that context, versus the sort of almost post-market surveillance approach, where things that do come on the market, is there some way we should be looking at them in a very broad screening way, just to see if they're getting out there into the environment or into people or not. And biomonitoring came up in that context, studying worker populations came up in that context. And then the third category being the chemicals where we actually are doing in-depth risk assessments and need a lot of data, and sort of binning things in that way, I think, is a helpful approach conceptually. And maybe, Paul, you can elaborate a bit on that.
Well, I just agree, and for purposes of a 15-minute presentation, I wanted to leave you all a message, and so I chose to go that route. But certainly, again, developing the tools like a screening tool and the like, it's about informing the specific of that from the general of what we already have. And we had a little bit of disagreement. I actually, in terms of prioritization of development for the science, I thought informatics should come early, not later. I think, informatics is most important almost when there are lots of data gaps and there aren't great data sets. That's where you're really challenged, it seems to me. But that's when you want to be developing that screening tool. So using the data as effectively as you can to come up with a somewhat reliable, and granted, you can get away with that at a screening level, to your point, is really important. So that's why I sort of took the twist on it. I did. But as I say, I think the bottom line is that we saw that approaching these things from an exposure perspective could very valuably inform the regulator. And that sometimes gets left behind in the story.
Yes.
Hi, I'm Harold Zinnick with US EPA. I'd like to provide some information, an observation, I think a question. The information is the Toxics and Risks Subcommittee under the Committee for Environment, Natural Resource Sustainability is actually developing a charter to put together an interagency work group on exposure sciences. How do we begin to move it forth? And I'll tell you, there was no problem getting members to want to participate on that. The observation I would make is, and John, your very first slide talked about what we may learn from human health risk assessment might inform eco risk assessment. I don't have it quite right. And I would argue it's actually the flip of that. Because what the ecologists do, and I've learned this the hard way because we have a laboratory that has some eco divisions and some health, is they for years have done problem formulation, problem identification. They've dealt with what are the potential solutions, are options that you have available. And I think we could learn a lot from those folks as to how you transfer that to human health assessment. And I think that's more than we sat down with the Air Office for a couple hours. We have a good feel for what they need. And I would like to see NAS or others actually take on what is involved in a formal problem formulation, problem identification process, and where does it lead you? Because I think that's a step that's missing in human health risk assessment. So I think that was a question.
So I think and I'm not sure what the slide said because I didn't make it, but I think what the committee was saying was exactly that, Paul, that the ecological risk assessment community does two things that the human risk assessment community could learn from. As I said, there was a lot of emphasis on the formative process, on figuring out what your questions are, how do you frame them, how deep do you have to go before you start the process, and that the ecological risk assessors do that because they're dealing with, much more complexity, and also the cumulative stressors. And, I had the opportunity to chair a human health risk assessment work group in a larger CTAC risk assessment conference. I was surrounded by ecological risk assessors, which is the first time that had ever happened to me as a doctor. And it was very informative. I think that there's a lot of learning that could be had there. And I don't know how much of that is, I imagine that does go on within the EPA where you have such strength in both areas, but that's a very good point.
I wanted to add one thing. In terms of those very detailed prototypes that we had, in two cases we had very good estimates of exposure dose, the benzene urinary biomarkers and O18 dosimetry for the ozone project. And we only had an estimate of exposure in the PAH prototype. And the measurement error and exposure just about swamped us. So it's not that it's, sometimes exposure from the health community gets dealt with like, oh, it's a nice thing to have, but it's a critical thing to have.
I can remember when I was at Oak Ridge Laboratory, we proposed a personal ozone monitor, basically cell phone based, to the agency, and they sort of dismissed.
Any other comment on it? No? Yes.
Hi, Al McCarthy. Just a quick note. At EPA, we do, in addition to the work going on at ORD and NextGen, et cetera, there's an inter-office group, that's sort of charged with sort of itemizing all of the NAS recommendations, including the ones from Science and Decisions, and developing a sort of master plan for how we're going to go after these recommendations. And that work is ongoing, and certainly Science and Decisions is preeminent among them. So we're making some progress, at least. I just wanted to respond a little bit to Bernie's. It's 2009. It was December 2009, so it is time that we do. But in addition, though, it's sort of worth observing that a lot of these new methods, new ideas, and new work come at a time when resources are certainly not growing in the agency. So it's a challenge.
Thank you. Yes.
Thanks. I'm very intrigued with all the talk about right sizing. And I know in our program in Massachusetts, we spent a lot of time trying to think about decision making and appropriate decision making for the companies that we serve. And our basic philosophy is that if you reduce the hazard, then you don't ever have to worry about the risk. But I'm really interested, Marilee, to know about whether you think the NAS panel will sort of approach this right sizing thing and think about some spectrum, or are you after more one methodology?
So I'm in a difficult spot. I can't really
Just in terms of the goals of the group.
I mean, I think certainly, that will come up. That I can't say if the final study will address that very much, but I would assume that the right size concept will come up.
So just while other people think of potential questions that they might have, I'll throw a question out to the panel. And it really builds off of what Paul said about the exposure and kind of how do we have this collaboration and bring both sides of exposure to the table and thinking about risk assessment, chemical safety management, TSCA reform. So just ideas about how do we bring exposure to the table, and is it important to do so? All of you can, it's an open question. Is it important? Do we need to do it?
One of the things that I did not emphasize enough when I was talking about these molecular patterns of disease that can be identified is it's pretty easy to see how they can form both biomarkers of exposure and effect simultaneously. And I really see the future as being if we're interested in population exposure or something, we'll go out and look for a biomarker of exposure and effect. And that's where I think that the biomonitoring data like CDC collects is going to become progressively more important.
So when we finally had a ballpark number on number of genes in the human genome, if you didn't slap your forehead and say, oh my gosh, how these things are expressed, how they're turned on and off is really going to be the key. And, so we have epigenetics and so on and so forth. And similarly with proteins, all those opportunities for environmental insinuation sort of just strike you, it seems to me. So from that day forward, sort of understanding when and how things are exposed to what we're concerned about, and even more about when more than one thing is happening, whether it just be a stress of a psychological kind compounded with a chemical. It just seems to me it comes from the fundamentals that it's ever more important.
Perhaps building on this, I'm not sure if this is where you were going, Paul, but I remember when I was looking at the omics at its very early boom about 10 years ago, there was a lot of optimism that the field of omics was actually going to provide us with great exposure signatures. That was the talk, 2003, 2004, and we'd really kind of get over this and be able to have, these great signatures of different exposures. And I think as the world of epigenetics has exploded on top of the world of gene expression and all of the omics, we've discovered an incredibly complex system with a lot of noise that we really have trouble making sense of. So I think there's kind of two, your question was about operationalizing it, and I think that there's tremendous knowledge to be gained from exploring that, and hopefully we'll get to a point where maybe there's some exposure tools. But the other side of this is just on the straight exposure technology side. And we are making great advances in the ability to measure things in real time in incredibly small samples. And I think, I cannot speak in great detail because I wasn't prepared to, but the National Institute of Environmental Health Sciences in its strategic plan and in some, a priority setting that's going on right now is placing a lot of emphasis and a lot of investment on exposure science, on exposure assessment, and on this innovation and technology side. And I think that's part of the solution, but I think it's I think it doesn't get us to the eco-exposome quite yet.
Thank you, John.
Yeah, I have a comment and then a question, Lynn Goldman. On the exposure science, in my career, the utility of exposure science has been completely different depending on whether I'm being a regulator or being an epidemiologist. When I'm being an epidemiologist, I want to be able to get in there and exactly measure the exposure levels that somebody has, and because I'm trying to figure out what the exposure is doing to them. When I'm being a regulator, I want to know all about the hazards, and then I want to know how you can be exposed, to what extent it's going to go through the skin or be inhaled or be, or have uptake through the gut. And as opposed to being precisely able to measure that, I want to be able to predict it. And because if I know the hazards and if I can predict that, then I can, make a good decision. And I don't want to wait until, people are already exposed. But I have another question, and this is about the report, John, that you reported on. And I go around a lot in policy circles where particularly that chapter about unification of cancer and non-cancer risk assessment gets cited in my view, in just completely different ways from people who are coming at it from different points of view, maybe even politically different points of view. And it just almost seems, I mean, I thought it was very clear. I reviewed the report. I was one of the reviewers. I thought it was very clear what the committee said. But what I hear repeatedly from people is they feel that the book has prescribed, a new set of directives about how one must, do these risk assessments always. And I hear that in opposite points of view completely. And I don't really know why that's the case. I think it would be helpful, if EPA could be clear, about what they think it means and operationally. But I just have found that to be very interesting because I actually thought you guys did a great job and it's a well-written chapter, but that somehow it's wound up being translated as meaning whatever people want it to mean. Anyway, I don't know if you want to comment on that.
I really don't have much of a comment on that other than, because I will not put myself forward as any one of the experts who actually conceived that and wrote it. As I said, I was more the water boy on the committee, but I think that it was a pretty bold and far-reaching concept, and I think that any one committee can only kind of go so far in articulating it and starting to describe it, and how it gets used and picked up and reacted to is out of the control of that committee. So I think. I don't think it was meant to be in any way prescriptive. It was really meant to start opening the discussion and just, but more than just say, you ought to do it. It was giving some idea of how that can be done, because a lot of time committees say do this, but they don't really go that next step. So the committee tried to go that next step, but it certainly wasn't meant to be prescriptive in doing so.
To be completely explicit, John, I mean, what I hear, I've heard both of these from very well-educated people, that it either said you should always assume a threshold, whether it's a carcinogen or a non-carcinogen, or you should always assume there is no threshold, whether it's a carcinogen or a non-carcinogen. I don't think it said either one of those things. And but I think it's very hard for all of us in the regulatory arena to get unstuck from wanting it to always be some way, right? That we can have an assumption we can latch onto.
So I guess the only other comment to make to that gets to the last recommendation about training and capacity building.
Great. Are there any other questions or comments? Panel members, any other last thoughts? Well, with that, we'll take a 20-minute break. So, thank you.